Another thing that it could be is that you could have a pregnancy in your tube.
Ooh, no. Okay. The ectopic?
That's right. Which I'm going to take a look at that. They didn't say anything when to that regard, did they?
No. The ultrasound machine was real shaky. I mean, it would short out and things like that. You wouldn't be able to tell if it's in the tube just by looking at that?
I'm going to take a closer look, but let me just take measurements of this and.
But, I mean, today it's gotten a lot better.
The bleeding has?
Yes, where it kind of almost, in a sense, stopped.
How many weeks are we?
6 weeks, 6 days.
It's measuring at 7 weeks, 2 days.
Yeah, which is fine. It can be, plus or minus a few days. And the fact that it's plus a few days is better than minus a few days. Now, your insurance is through Kaiser?
Yes.
Is that the heartbeat?
That's the heartbeat. We're gonna need some more printing paper. All right, let's look here.
I mean, I haven't really had too much bad pains. Only one night did I have like really bad pains. And I didn't know how to describe it, but to me, what is that?
That's, looks like another pregnancy
That didn't fully,
that's attached
uh-oh,
outside of the uterus.
outside. So the second one did make it, but,
Yeah, looks like it's in the fallopian tube.
okay,
What does that mean?
not good.
Um,
Do I have to undergo something?
yeah, this has to be taken out, and the way that it's done is through a laparoscopy.
Okay.
Now, you went to the Kaiser emergency room yesterday?
Yes, yes.
Which one?
West Los Angeles.
Okay. Did they check a CBC, a complete blood count?
I don't believe so. If they, I guess not if, but when they do that procedure, would it bother the one that's,
You know that
Ow.
it shouldn't. Does that hurt?
part of it did, yeah, a little bit.
You know it shouldn't.
Okay. What does that mean?
Yeah.
I'm not sure. I mean, they're going to have to go inside and have a look and then determine. Determine if it's actually attached to the ovary or.
Are you serious?
Yeah, which I doubt that's the case. I mean, that's extremely rare. And even if it is, it's not a big deal. Either way, it has to be removed.
You mean the bad one or the
The
good
bad one, yeah. No, not the good one is, is left behind.
So they might have to remove my ovary?
No. I doubt that's going to be the case. But if it is attached to the ovary and they can't remove it safely, they may have to.
Okay.
Yeah, but I doubt that's going to be the case.
What happens to the other one?
The other one is in the uterus, so it's...
There is
It's-
one in the uterus?
Yeah,
Okay.
definitely. Yeah, definitely.
So it would not affect that one, right?
No.
Hopefully. That procedure would have to be done pretty soon?
Yeah, I mean, in fact, I would go from here to the emergency room again and tell them that you saw your doctor and your doctor said you have a left tubal or left, I'll write it down, you have what we call a heterotopic pregnancy.
Okay,
It's extremely rare.
okay.
It's when one pregnancy is attached in the uterus
Uh-huh.
and one pregnancy is attached outside of the uterus.
Okay,
Extremely rare.
okay.
Yeah, so
So the
in fact, it's the first time that's happened to me.
Okay.
Yeah.
So the emergency room would be able to take care of that?
That's right. Well, they would have to, get in the gynecology team involved
Uh-huh.
and then, kind of take
Does
it
that
from there.
procedure hurt? Does it suck real bad? Did it put you under?
There we are. I see the heart beating away.
Oh, excuse me, I'm sorry.
And we'll listen to it in a minute. Gonna be a pre-Christmas baby.
Really? Before Christmas? Oh, this is the part Dan's interested in. Good heartbeat, huh?
Very good.
Wow. I heard it's supposed to increase 3.3 beats a day, so I was thinking it should be about 150. It's way ahead.
161.
Yeah. Do you believe in the wives' tale where they say girls, her beats are
Faster?
faster than the boys?
So you're thinking it's a girl?
I don't know. Dana keeps saying Simon knows. He punctured. He did the not the well that too, but he did the assisted hatching, so he knows. He probably put one boy and one girl.
But no, he has no way of knowing. But it's the sperm that determines it.
Yeah.
Yes.
He's all corner Simon, find out.
In general, the girls may have a higher heart rate,
Uh-huh.
but higher than what? That's
That's
the
true.
kind of
That's true.
yeah. So it's kind of the unless you have a reference point, then you can't really tell. But the heart rate, the heart's beating very nicely. As far as we can tell by this ultrasound, everything's formed perfectly.